Right now, Milwaukee County is asking for your help. The city's health department wants residents to weigh in on top health needs within the community. To talk about it, Marcus Hogans with the Milwaukee Health Department and Bridget Clemente of Children's Wisconsin. Now, you all do this survey every few years.
3 years.
Every 3 years.
Yeah,
what are you
every
looking
3
for
years.
with this?
You know, this is not the first time that we've done this, but it is the first time that we're working in partnership with the City of Milwaukee Health Department and the County Health and Human Services. And we really want to understand what matters most to the community members and representatives and residents of our county.
And what do you find with this survey? Does anything surprise you about the health needs that you do find?
The health needs vary a little bit from year to year, but again, it's really what matters most. And then it allows us as partners and as individual health systems that are all involved to really invest meaningfully in the ways that, again, matter most to those that are providing us this data and feedback.
What do you find that the information that you get from this, how do you change how you go about health issues?
Yeah, I think kind of what Bridget said is it's helped determine what some of those activities, those interventions that come out of the health systems, but also the health department. So we have a lot of programming that is public facing, so it allows us to adjust on the fly to those public facing needs.
Does it allow you to be more proactive than reactive with health needs?
Absolutely, and allow us to watch and understand what impact we are making. So as Marcus said, some of this work happens individually from the health systems, but some of it happens collectively through the Milwaukee Healthcare Partnership, and we're able to understand, are we making an impact, are we not making an impact, and again, what really do residents want us to be tuned into and focused on to improve the health and well-being of our community?
Who should take the survey?
Everybody.
Everybody.
Okay.
If you're over 18 years of
Okay.
age, take the survey. If you have friends, tell them to take the survey.
For someone
And
who's never-
families, coming from children, I
Families.
certainly want families to take the surveys as well.
From someone who's never taken it, what should they expect with it? What kind of questions?
Yeah, it's about 10 minutes in length, and
Okay.
it really asks just general health-related questions. So you don't need to know, really specific information about your health or the health of your family members or your household, but enough to give us some deep understanding of what are your concerns, where do you believe we need to lean in on, and pretty simple.
Okay. And really quickly, some incentives, right?
Yeah, we got a couple, concerts, Future, Peso Pluma, but also I think for the families, there's family-oriented events. If you take the event at certain events, some of the organizations have specific incentives they'll give there too, from gift cards to maybe trips to an outing. So.
And don't delay. Some of those
The sooner- yeah,
incentives
the sooner
are
you take it,
not
the better, yeah.
available until after August.
After August,
right?
yep.
Yeah.
After August.
So don't
Got it.
delay.
Okay, do it now. All right. Thank you so much for joining us and for providing us with that information. We appreciate it.
Thank you.
Patrick?
All right, Kristen, thank you. Enjoy this weather while you can.